All right, good morning, everybody. Sorry about that. So I was trying to figure out how to record this. We were going to go on Facebook Live. So we're not going to be able to do that on this one. So what I'll do is I'll post this after this press conference on social media for folks to watch and also on YouTube. So with that, Adrian, thank you so much for being available this morning and to all of our media partners. We're going to go over the press release that we put out just a little while ago that talks about the vaccination that was approved for those that are 12 years to 15 years and older, or 12 years and older, but the latest was 12 to 15. So with that, Adrian, I'll turn it over to you, and then we'll take questions at the end.
Okay, good morning. So the Federal Drug Administration and Center for Disease Control and Prevention have approved the use of the Pfizer COVID-19 vaccine for use in 12 to 15-year-olds. Now, even though fewer children have been sick with COVID-19 compared to adults, children can still be affected with COVID-19, and there's no way to tell in advance whether they might have a very mild case or severe case. So it's important that all children age 12 to 15-year-old that can be vaccinated. And tens of thousands or thousands of adolescents have received the COVID-19 vaccine during clinical trials. And we already know that tens of millions of adults in the United States have received the vaccine really under the most intense safety monitoring in the US history. So at our 223 location, that vaccine will be available for the 12 to 15-year-old, whether walk-in or by appointment, whatever your preference is. And we will start that today so that anyone that can bring their 12 to 15-year-old in, we are ready. That age group, they can have some of the same symptoms that adults have had from the vaccine, but it is usually mild and lasts a day or two, and then they are vaccinated against COVID. The trials have been showing 100% effectiveness, and we know in adults it has been very effective in keeping adults out of the hospital and from dying. I'm available for any questions.
Okay, we'll just go around. Hunter, you're up first. Any questions from you?
Yeah, so I'm going to start off with my first question. So I was chatting with someone the other day. They said, you know, they've been getting COVID tests back, and they even mentioned seeing a lot more, excuse the loud sounds, we're getting our roof fixed. But we are seeing, you know, a lot more younger kids end up getting the virus right now. So I guess one, is that something you're seeing? But two, I guess, you know, does that just show kind of the importance of getting the shot right now and how it's open?
It does, because there are more variants in Sedgwick County all the time. And we've seen across the country where younger people are getting ill with COVID. And even if they do have mild symptoms, they can still transmit to other people that, you know, may be more prone to more severe symptoms from COVID. So it's important for both those people around the adolescent and the adolescent themselves.
And then just kind of following up to that, so would you say that you, like specifically in Sedgwick County, have also seen more kids testing positive than what we've seen, I guess, in the past?
You know, we still have more from the older age group beyond 12 to 15, but yes, we do have all age groups that are getting COVID.
And then from here, I know we kind of talk about, you know, phasing out the mass clinics. I guess, you know, now that we're finally touching on this age group, do you think that we will, I guess, kind of what's the next steps? How long do you plan to maybe keep it open, and what's that phase out process look like?
Well, we are definitely looking at all aspects, whether it be to phase out the clinic or to keep it going, or the ability to ramp it back up. So like everything else with COVID, it's difficult to have a firm plan in place. So we are going to be nimble and fluid. And if we need to keep it open beyond June, then we will. We know that there are talks of boosters, whether it be 9 months or a year. So we are in discussions with partners on what they can absorb, and that will help us with our decision and what we need to do, as far as what's best for our community.
And then my last one, just how does it feel? You know, we've come a long ways. This is a big milestone for us to be able to touch the next age groups. I guess, how does it make you feel?
Well, it's exciting, really. It's hard to believe that we are here at this place, that it seems like a long time ago, but it wasn't, that we started with, 85 and older. So to know that we are able to get more of our community vaccinated is really important, because widespread vaccination is critical to helping us end this pandemic that we're in. So very happy that we're going to be able to get our adolescents vaccinated, and for parents and anyone in that 12 to 15 age group that have been not participating in events that they wanted to participate in, or participating but being worried about their adolescents, or the adolescents having some anxiety about it. So this will reduce that and make it much safer for them to participate in events.
Awesome. I'll let everyone else go now. Thank you.
Everett, I see you're up next. KWCH, do you have any questions?
Hey, Akeem, I'm going to ask the questions. Do you want me to just go ahead and go?
Yep, you bet.
Okay, perfect. Hey, Adrian. Hey, I know I see it in the press release right here, but can you kind of explain the process? How are you guys going to make sure that this child is 12 to 15? Does a parent need to be with them? Can you kind of just explain that process for us?
Yes, thank you. So just like with 16 and 17-year-olds, but particularly for 12 to 15, because they oftentimes are not going to have driver's licenses. So that's the one time that we will ask for identification. And if they don't have any kind of identification because they are younger, then we have a form that parents can sign where they attest that their child is 12 years of age and older, and of age to receive the Pfizer vaccine. If a 16 or 17-year-old comes in and they have identification with their date of birth and their parents aren't there, then we'll FaceTime or call their parent to make sure that they are aware and are approving of their 16 or 17-year-old having the vaccine. But for the younger age group, we will need the parent there so that they can sign that form. Thank you for asking that.
Perfect. Then also, how are you guys going to be working with community partners? If there's local doctors' offices or, CVS, kind of how are you guys going to be working with them to know how many people in this age group are being vaccinated?
Well, we have been working and transferring vaccine to a lot of partners, some in the medical community, in the pharmacies. And so we are in the process of reaching out and double checking to see if they are also comfortable with a 12 to 15-year-old age group, or if they were more with just adults. But we anticipate that most in the community that are providing vaccines right now will continue to. And if there's any new partners that want to partner and get vaccine, we are more than happy to do that. They just need to reach out to the health department, and we will arrange to either have a partner clinic with them or provide vaccine to them if they are an approved provider through Kansas Department of Health and Environment.
Perfect. And then last question, what would you have to say to those parents who might have some reservations or might be nervous about getting their child the vaccine if they're 12 to 15? Kind of what would you recommend or say to them?
Well, I would say that is understandable, and it's okay to be cautious that this is new. If they are on the fence, I'd recommend that they talk to their pediatrician. If their pediatrician or family physician, if they're not giving vaccine, to go ahead and talk to them, ask their pastor or anyone that they trust and hold in regard, and just know that this vaccine has been under more scrutiny than ever any vaccine in the history So all eyes are on and wanting to ensure it is safe. And right now it has shown safetiness for adults and for 12 to 15-year-olds.
Awesome. Thanks so much, Adrian.
Welcome.
Thanks, Haley. Okay. Who's up next? Michael?
Hello. Hey, so Haley kind of asked it, but I was just curious on the status with not just partners, but like having your pediatricians or I don't know what are they not approved, or is that something you feel like would really help with this age group, since I'm sure that's someone they probably see at least annually for their, you know, back to school shots and stuff. Where are we at with that, or what's the thought with that?
Well, we reached out months ago through the Medical Society, letting physicians know that they could, and as Kansas Department of Health and Environment did, letting them know that they could be an approved provider and what they needed to do as far as the steps to go through. So we are always happy and really would like pediatricians to be on board, because parents trust their pediatrician or the provider that they used to vaccinate their children. And if they go in for school vaccines and want to wait, then they can have, now it's been approved that they can have their regular vaccines on schedule as well as COVID vaccine. So if there are any providers that have waited to be approved, and they don't have to be an approved provider for us to partner with them and provide vaccine. So they just need to reach out, and quite a few have. When we did do a parent survey and asked where they would be most comfortable having their children vaccinated, and over 85% said their pediatrician or family doctor, and then schools, and then health department were the top three. So we would love to have more doctors part of to be able to provide vaccine, knowing that that's where a lot of parents are really comfortable with having their children vaccinated. And they don't all report to us because they don't have to, but everybody needs to report through the KDHE state vaccine system registry. And we do have a reportable, we have a site on the health department, the county website, where all providers that are giving vaccine can go in and report how many that they are giving. And we have a lot of partners in the community that are providing that information.
Good. So just I lost you for a second, but I think I heard what I needed to. But the 85%, are you saying that that was for pediatrician, family doctor, school, and health department? So that was what 85% of them said would be comfortable?
Well, so over 85% of the respondents, and I forget how many hundreds responded, that 85% preferred their family physician or pediatrician to provide the vaccine. And then the next group were schools and then health department.
Okay. Thanks for the clarification. The only other thing I got is, I know it's approved for this age group. Do you know if anyone else in Kansas is doing it yet? Or I mean, do you think that you actually might be administering the first shots for the 12 to 15 children? Or
no? Well, what local health departments do or are supposed to do is wait for the governor or the Kansas Department of Health and Environment to okay it. And they did that last night. So everybody should be starting today. If they opened up at 9 a.m. before we did, they may be vaccinating, but today would be the first day.
okay. So you guys got the green light then last night from KDHE?
Yes, yes.
Thank you. That's all I got.
All right. Thanks, Michael. John, are you there?
Yes, sir. Adrian, Dr. Lee Norman mentioned earlier this morning that 160,000 Kansans made up the age group overall across the state of Kansas. Can you kind of reference how many residents here in Sedgwick County this is going to be affecting, or you guys are kind of targeting right now?
Yes, well, we know what the 12 to 17 age group is, and that's about 45,000 kids. So, you could extrapolate in there, but we have the data that shows 45,000 for 12 to 17. So it's safe to say there are a lot of adolescents between 12 and 15 that are eligible to be vaccinated in Sedgwick County.
And Adrian, Haley kind of touched on this earlier, but how are you all expecting this to impact vaccine hesitancy? I know we've seen kind of that straddling line where we've kind of reached that tipping off point of, oh, we're trying to get more of these people to come in and get these shots. How do we think that opening this up to this new age group is going to impact that?
Well, I can tell you that the last couple of days after the CDC announced, or the FDA announced that they gave the emergency use, or expanded the emergency use authorization to 12 to 15, that the very next day we had 30 to 40 parents that came in hoping to be able to get their kids vaccinated. And I realize that that is a small number, but we know that we're going to see an increase at clinic. And if parents are hesitant, and that is totally understandable, they can call and we will share any information that we have with them. And again, if their pediatrician or family provider is not providing vaccinations, to please call them and listen to what they have to say about the safety and importance of giving the very active 12 to 15-year-old age group, get them vaccinated.
Yeah, and touch kind of on the importance of these shots for this age group. I know education has been a big priority when considering these vaccinations in the past year. A lot of people may be thinking to themselves, oh, this age group isn't as acceptable to hospitalizations or deaths. Why should I care? Kind of touch on like what this could mean going forward in the future as far as getting back to normal.
Well, and we know that is a true statement that people can make, that this age group has been much less affected, and definitely not, severely. There have been some very poor outcomes in this age group, but in comparison to the rest, it's been very minor. But this age group, they're also very active. And we had, clusters or outbreaks in schools, in middle schools. And so we know that was occurring and will occur. They're active on, in sports and other activities. And again, even if they don't show symptoms, if they're carrying the virus, or very, very minimal, where you think it might be a cold, kids are still around other adults, grandparents, great-grandparents, and we all know that those age groups are very much more at risk for very severe outcomes. So it's important. And then the other side is anxiety. I know, I've heard how many parents have been anxious and have been waiting for this approval for the 12 to 15-year-old age group. And they're also waiting for the 12 to 14-year-old age group, just because of the anxiety that people have had wanting to protect their children. So again, it is totally understandable to be hesitant, but also looking at what can happen and protecting those around that 12 to 15-year-old.
Thank you.
Thanks, John. Haley, I know you texted me an additional question. Go ahead and ask that if you'd like to now.
Oh yeah, sorry. I was just asking if you guys were going to keep it at, I heard you say at the 223, the downtown library, but wondering if you're going to expand that into mobile clinics, or even if you could possibly do something with Sedgwick County schools. I know that people trust their schools, so wondering if you guys are thinking about expanding into other places as well.
We are already on that, Haley. We are in discussions with several schools and hope to be rolling that information out soon. But absolutely, when we know that the parents or the community trust providers, even beyond the health department. We are going to be reaching out to them because we want to do everything we can to make it accessible and to increase that comfort level with getting anybody vaccinated, particularly children. So yes, we are on that. And any mobile clinic that we do anywhere now will expand to 12 to 15-year-olds. So 12 and on up will be eligible to come to any mobile we have. And please check the Sedgwick County website because we have usually at least one mobile every day.
Awesome. Thanks so much, Adrian.
Okay, thanks so much, everybody. Adrian, do you have any final comments at this point? Media partners are able to go to the vaccine clinic today to kind of get video,
Yes.
pictures, that kind of thing. Okay.
So, I will be there probably at 1 o'clock and after, but I really appreciate all of you wanting to get this information out. And again, it has proven to be very safe, and many of us or all of us on this call have been vaccinated. And so please come down, and anybody can call and schedule or just walk in. We will be ready for you and do anything we can to help this be an okay experience for your 12 to 15-year-old. Thank you.
Thanks, everyone.